In the United States, more than 2/3 of people over 65 are taking at least 5 medications a day. There are blood pressure medications, sleeping pills, diabetes medications, arthritis medications, stomach medications. The list goes on and on. The scary thing is, many of them are unnecessary and can even be harmful. Some make us confused. Others weaken our muscles, increasing our risk of falling. Some cause our hearts to beat irregularly, increasing our risk of stroke. And some pills, which at first seemed to make us healthier, are quietly shortening our lives day by day. Margaret, 68, used to have long nights of tossing and turning until she cried. Her husband died early, her children lived far away, and her small house became too quiet at night. She tried everything, drinking herbal tea, reading books, counting sheep, but she still couldn't sleep. Finally, the doctor prescribed a sleeping pill with a rather sweet-sounding name, Zolpidem. The first time she tried it, she slept for 7 hours straight, no dreams, no waking up in the middle of the night. This is amazing, she thought, and from then on, it became part of her bedtime ritual. But then things started to change, The dark side of deep sleep, Margaret began to forget things. One time, she left a pot of porridge on the stove and almost set it on fire. Another time, she walked down the street and forgot where she was going. She found herself tired during the day, losing her balance and falling. As it turned out, what she experienced was not uncommon. Zolpidem, also known as Ambien, and similar sleeping pills known as hypnotics, are commonly prescribed to older adults. But as the body slows down with age, the side effects become more pronounced: confusion, temporary memory loss, movement disorders, and especially a doubling of the risk of falling, one of the leading causes of death in the elderly. Research from the Journal of the American Geriatric Society shows that people over 65 who take sleeping pills are up to 70% more likely to be hospitalized for falls than those who do not. And not only that, strange behaviors during sleep, such as eating, walking, even driving, but completely forgetting about it the next morning, have also been recorded. Why is it so dangerous? We often think that being able to sleep is a success. But sleeping on drugs is a forced sleep, not a natural sleep. It does not help the body recover as deeply as you think, and more importantly, it causes the brain and muscles to be repressed, causing impaired daytime function. In young people, the liver and kidneys can metabolize the drug effectively, but in older people, the drug stays in the body longer, causing drowsiness and confusion even after waking up. That's why many doctors don't prescribe sleeping pills for themselves, even though they can prescribe them for their patients. So what if you don't take sleeping pills? Here's the strange thing: sleep can't be forced, it has to be gently invited. And it's possible. Instead of taking pills, natural methods like cognitive behavioral therapy (CBTI), meditation, gentle yoga, and proper sleep care have longer lasting effects, no addiction, no side effects. Sleep in a cool, dark, quiet room. Don't look at screens before bed. Spend 20 minutes reading a relaxing book. Drink a glass of warm milk or chamomile tea. Even tart cherry juice, a natural source of melatonin, has been shown to improve sleep duration and quality in older adults. A little lesson from Margaret. Finally, thanks to a friend at church, Margaret sought out a sleep therapist. She gradually cut back on her medication under her doctor's guidance, practiced deep breathing every night, and did short 5-minute meditations. Sleep came more slowly, but more naturally. And most importantly, she woke up in the morning without feeling tired, groggy, or forgetful. Sleep is no longer a gentle trap in a pill, it's a gift I give myself every night, she says. And Margaret isn't the only one who has fallen into the gentle trap of sleeping pills. There's another drug equally popular that seems to help relieve back pain, knee pain, joint pain. But it's actually eating away at your heart, destroying your kidneys, and silently causing stomach bleeding. James is a former postal worker, now 71 years old. He lived his whole life on his feet, delivering mail in the rain or shine, crossing streets, climbing stairs. But when he retired, his knees started to protest. Every time he went down the stairs, it was a stabbing pain. At first, he tried hot oil, covered himself with a warm towel. But then a neighbor advised, "You should take ibuprofen. I've been using it for years. I feel so much better." And so every morning, after breakfast, James took a pill. A tiny pill. Cheap. easy to buy, and effective immediately. Only thing is, he didn't know that each pill was silently harming his body every day. NSAIDs, familiar but not harmless painkillers. NSAIDs, short for non-steroidal anti-inflammatory drugs, are the most popular group of painkillers in the world. The names like ibuprofen, Advil, Motrin, naproxen, Aleve, and aspirin are all too familiar, found in most home medicine cabinets. They are used to relieve headaches, joint pain, toothaches, fevers, and inflammation, and they do work. But for older adults, NSAIDs can be a double-edged sword. Potential harm from long-term use. The problem isn't one pill. It's that many people take them every day for months, even years, without realizing that. NSAIDs increase the risk of stomach bleeding. Older people have thinner stomach walls, and the amount of protective mucus decreases with age. These drugs eat away at that protective layer, causing ulcers and even gastrointestinal bleeding. They can seriously damage the kidneys. NSAIDs reduce blood flow to the kidneys. This is not a concern in young people, but in older people or those with high blood pressure or diabetes, the consequences can be chronic kidney failure, increased risk of heart attack and stroke. Some studies have shown that long-term use of NSAIDs, especially naproxen and diclofenac, can increase the risk of blood clots and heart attacks, especially in people with underlying cardiovascular disease. Real-life example. Mr. James is hospitalized. After 6 months of taking ibuprofen every day, Mr. James started to feel sick to his stomach and had a poor appetite. One morning, he vomited blood and had to be rushed to the hospital. The doctor diagnosed a stomach bleed. When his kidney function was tested, it had also started to deteriorate. The doctor said, "It's not your age, it's because you're taking the medication too regularly. Older people's bodies can't process it like younger people." So if you don't use NSAIDs, what can you do to relieve pain? Fortunately, there are safer options. Acetaminophen Tylenol, a non-NSAID pain reliever that is safer for your stomach and kidneys when used in the right dose. Heat therapy. Using hot, cold packs properly can effectively relieve pain. Gentle exercise such as yoga, swimming, and walking in water can help improve arthritis and increase muscle strength. Supplements such as glucosamine and curcumin from turmeric are used by many older adults to reduce mild inflammation and improve joint health. Most importantly, don't take medication every day without talking to your doctor. Even over-the-counter medications can be harmful if used incorrectly. A little lesson from James. After his hospitalization, James stopped taking his daily pain relievers and switched to physical therapy, water exercises, and acetaminophen when needed. "I used to think that as long as it didn't hurt, it was okay," he says. "But now I understand. Temporary pain relief that causes long-term damage is not worth it. And pain isn't the only enemy lurking behind the facade of normalcy. There's another group of drugs often prescribed for mild anxiety, trouble sleeping, or just feeling off inside that can quietly cause you to lose your memory, reflexes, and clarity even when you think you're fine." Linda, 73, used to be a literature teacher. She loved poetry, loved making tea in the morning sitting by the window, and especially loved the peace in her mind. But in recent years, after the sudden death of her husband, she began to have trouble sleeping, not because her body wasn't tired, but because her mind wasn't at peace. The long sleepless nights gradually made her anxious, confused, and quietly lost pieces of herself. A doctor prescribed her a drug called lorazepam, just one little pill every night to relax, to help you sleep better. Linda took it, and true to its word, she slept. But soon her daughter realized something was wrong. Calming drugs, but at what cost? Benzodiazepines, such as lorazepam Ativan, diazepam Valium, alprazolam Xanax, are a class of drugs commonly prescribed for anxiety, insomnia, and panic attacks. They work by calming the central nervous system, almost turning off the noise in your head to help you feel more at peace. It sounds great. And indeed, when used short-term, in emergency situations, they can be very helpful. But the problem is, many older adults are stuck taking them every day for months, even years, without being explicitly warned about the consequences. Silent but serious side effects. In older adults, benzodiazepines stay in the body longer, causing side effects that last even after they stop taking them. Short-term memory loss. Users often forget conversations, appointments, or where they put things. Confusion, lightheadedness, confusion about day and night. Loss of balance. The risk of falls, fractures, and hospitalizations is doubled if benzodiazepines are used long-term, according to a study in the BMJ. Real-life story. Linda and the empty kitchen. One morning, Linda's daughter came over. She noticed that her mother had left boiling water on the stove. EP, for the third time this month. The food in the fridge has not been thrown away. And during the conversation, she repeats the same question 3 times in just 10 minutes. Her daughter takes her back to the doctor. After neurological tests, the doctor concludes mild cognitive impairment due to long-term use of benzodiazepines. The bad thing is, if the medication is not stopped, the condition will continue to worsen. Are there any alternatives? The good news is, there are. And you don't have to give up your sleep or peace of mind. Some recommended alternatives to benzodiazepines for older adults include cognitive behavioral therapy for anxiety and insomnia. CBT helps change the way you think and respond to stress. Mindfulness meditation, restorative yoga, music therapy or aromatherapy. Soothing herbs such as valerian, chamomile, or L-theanine. If necessary, non-addictive anti-anxiety medications such as buspirone can be used under a doctor's supervision. Tapering off benzodiazepines should be done slowly with guidance because stopping abruptly can have a negative effect. Linda's lessons. After weeks of working with her doctor and a psychologist, Linda gradually tapered off her lorazepam. Instead, she learned to keep a journal, practice deep breathing, and attend a weekly book group. I no longer need a pill to calm my mind, she says. I've learned to be at peace, from within. But benzodiazepines aren't the only drugs quietly eroding the sanity of older adults. There's also a dangerous drug in disguise, prescribed every day, every hour, to millions of older adults that few people know can cause memory loss, depression, and chronic dizziness if used incorrectly. George is a veteran. At 68, he's still going strong, loves tending his backyard garden, and taking morning walks around the lake with his dog, Max. But then, a few months ago, he started to feel different. It wasn't clear if it was fatigue or lethargy, but it was clear that he wasn't running after Max like he used to. His legs felt heavy, his muscles felt lifeless. At night, they ached. And in the morning, just getting out of bed made him wince. When he told his doctor about it, he got a shocking answer. That could be a side effect of the statins, George. Statins, friends of the heart, but are they always good friends? Statins, like atorvastatin Lipitor, simvastatin Zoca, rosuvastatin Cresta, are among the most popular medications in the United States. They are prescribed to lower bad cholesterol LDL levels and reduce the risk of heart attacks and strokes. And they do work, especially in people who have had heart disease. But for older people, the picture becomes more complicated. Silent but serious side effects. One of the most common complaints from people taking statins is muscle pain, weakness, cramps, stiffness, generalized fatigue, even after a full night's sleep, decreased stamina, unable to move as well as before. About 10% of people taking statins experience muscle pain, and the risk is significantly higher in people aged 60 and older, when muscles have already started to naturally deteriorate. In rare cases, statins can cause rhabdomyolysis, a serious condition in which muscle breaks down, releasing toxins into the blood, affecting the kidneys, and even being life-threatening. Real story. George and the strange drug. When George reviewed his medication records, he realized that his muscle pain had started just a few weeks after starting atorvastatin. After talking to his doctor, he was switched to a lower dose and to a statin with fewer side effects, pravastatin. He also added a Mediterranean diet and daily light exercise. After 2 months, he regained the strength in his legs and his smile. A little lesson. Not everyone needs statins. The latest medical guidelines say people 75 and older should be carefully reconsidered before continuing statins, especially if they have no history of heart disease. In many cases, lifestyle changes, eating a healthy diet, exercising regularly, and controlling weight and blood pressure can provide the same benefits without medication. If you're taking statins and feel weak, have muscle aches, or feel tired for no apparent reason, don't keep quiet. Talk to your doctor. There are other options, or simply a dose adjustment. But statins aren't the only drugs that can affect your muscles. There's another class of drugs often used to ease the blues after a loss, after retirement, or during the lonely years of old age that can quietly paralyze both the mind and the body. Linda, 72, went to her church's annual women's meeting that day, as she did every year. But this time, something was different. She couldn't walk, as agile as before. Each step was a challenge. When she smiled, she hid her slightly shaking hands in her pockets. As she sat down at the table, her longtime friend asked softly, "Linda, are you still okay? You look like you have difficulty walking." Linda nodded, but then whispered, "I don't understand. For the past few months, I have had pain in my calves, fatigue in my shoulders, and I don't have the strength I used to have. I still walk, still eat vegetables, but I just keep getting weaker." A week later, at the clinic, the doctor looked at her medication list and asked, "When did you start taking simvastatin?" Statins, heroes of the heart. But do they have a dark side? Statins, such as simvastatin Zoca, atorvastatin Lipitor, rosuvastatin Cresta, are the most popular drugs for lowering bad cholesterol LDL, thereby reducing the risk of stroke and heart attack. In people with a history of heart disease, statins save millions of lives each year. But the problem arises when we look at older people like Linda. The silent but persistent side effects. Some of the most prominent and troublesome side effects are muscle pain, weakness, cramps, fatigue, loss of stamina, reduced ability to exercise, difficulty sleeping and feeling not yourself. The rate of older people experiencing these side effects is much higher than that of younger people. And the worrying thing is that many people do not associate these symptoms with statins, causing the condition to last for months or even years. In severe cases, statins can also cause rhabdomyolysis, the breakdown of muscle tissue, and kidney damage. Although rare, this can be life-threatening if not detected early. Linda's story, after her doctor suggested stopping the statin for 4 weeks to monitor, something miraculous happened. After just 10 days, her muscle pain began to subside. She was more mobile, slept better, and her spirits were up. When she returned for a checkup, her doctor decided to switch her to a milder statin, pravastatin, along with diet, exercise, and regular follow-up visits. After 3 months, her cholesterol remained stable. No more muscle pain. And most importantly, Linda felt alive again. A small lesson. There is no one-size-fits-all. The most memorable thing about Linda's story is this. Even the best medicine needs to be tailored to your body. If you are taking statins and find yourself feeling unusually tired, having muscle pain, or having decreased activity levels, don't just chalk it up to getting old. Ask your doctor. It may be possible to change the dose, change the medication, or consider an alternative lifestyle. The muscular side effects are obvious, but sometimes the nervous system is affected silently, slowly, little by little. And the drug we are about to discuss can do just that. It is often prescribed to help you feel less sad or sleep better, but it is quietly draining your alertness and balance. Frank, 78, used to be the living memory of the family. At every family gathering, he recounts every detail from a holiday 30 years ago. He even remembers the red sweater his wife wore to the Christmas market in Chicago. But lately, his wife, Elaine, has noticed something has changed. He has started repeating the same story he told 10 minutes ago. He has forgotten where the remote control is. He picks up his coffee and puts it in the refrigerator instead of on the table. "We thought it was just a sign of aging," Elaine said. "But it happens so fast. It was like someone was turning off a switch in his head." The silent saboteur. What are anticholinergics? Anticholinergics are a class of drugs that work by blocking acetylcholine, an important neurotransmitter that helps maintain memory, concentration, and bodily functions like heart rate, bowel movements, and fluid secretion. Drugs in this class are not uncommon. You may have heard of them or are taking them without realizing it. For example, diphenhydramine allergy medicine, oxybutynin for nocturia, overactive bladder, amitriptyline, tricyclic antidepressant, Hydroxyzine, for anxiety and insomnia. Cyclobenzaprine, muscle relaxant. They are found in cold medicines, anti-nausea medicines, over-the-counter sleeping pills, and even prescriptions for shoulder stiffness, insomnia, allergies, etc. The problem is, in older people, when the brain has already begun to decline naturally, blocking acetylcholine is like taking away the rest of the memory. Research and warnings worth noting. A prominent study in the journal JAMA Internal Medicine followed more than 3,000 older people for 10 years. The shocking results: those who took anticholinergics for a long time had a 54% higher risk of developing Alzheimer's. Furthermore, even low, short-term doses can cause temporary memory loss, cognitive dysfunction, and impaired information processing. Frank's story, a surprising ending. When he visited his neurologist, Frank was asked to bring all of his medications with him. On the list was oxybutynin, a drug for overactive bladder that he had been taking for nearly 2 years. The doctor immediately decided to stop the drug and switch to another option that did not have anticholinergic effects. After only 4 weeks, Elaine began to see Frank again. Slowly, little by little, but enough to notice, he began to remember recent events. He repeated stories less, and most importantly, the light in his eyes returned. A small lesson. Beware of seemingly harmless drugs. Many people think that only strong drugs are worth worrying about, but in fact, it is the small, easy-to-buy, over-the-counter pills that are quietly harming the brains of older adults. If you or a loved one over 60 is taking multiple medications, especially sleeping pills, allergy medications, or nighttime medications, check the ingredients. And don't hesitate to talk to your doctor about safer options. We've talked about memory, muscles, sleep, but there's one area that's easy to forget, but incredibly important: the gut and stomach. The medication we are about to talk about seems like a no-brainer. It's just to relieve heartburn and bloating. But when used long-term, it can cause brittle bones, vitamin deficiencies, and weaken your immune system. Uncle Louis, 72, has been extremely disciplined about his health since being diagnosed with type 2 diabetes 10 years ago. Every morning he wakes up at 6, walks for 20 minutes around the block, and eats oatmeal and a boiled egg for breakfast. He carries a blood glucose meter with him at all times, and carefully records each number. But lately, something has been bothering him and his wife. Louis had frequent mild diarrhea, persistent fatigue, and, most importantly, rapid weight loss, despite not eating poorly. That's strange, the doctor said. Your blood sugar is very good. But when his wife asked, good, but is it too good? The doctor started looking back at the medication list. When medications become a double-edged sword. Diabetes medications, especially those like metformin, SGLT2 inhibitors such as Jardiance, Farxiga, or sulfonylureas such as glyburide, are commonly prescribed to control blood sugar. They can be very effective, but for older adults, effectiveness is not everything. Metformin, for example, can impair the absorption of vitamin B12, leading to numbness in the limbs, fatigue, and even memory problems. SGLT2 inhibitors help reduce sugar in the urine, but they also increase the risk of urinary tract infections and dehydration, which can be especially dangerous in older adults. Sulfonylureas can cause sudden hypoglycemia, which can cause dizziness, falls, or even unconsciousness, and that can be life-threatening when you're home alone. Real-life example. Louis' story: his doctor discovered that Louis had been taking a high dose of metformin for years, and he had never had his vitamin B12 levels tested. When he was tested for additional B12, his B12 levels were below normal. This partly explained his persistent fatigue and unexplained weight loss. Soon after adjusting his medication, taking vitamins, and monitoring his nutrition more closely, Louis began to regain his strength. And most of all, he began to understand that living well with diabetes is not just about keeping your blood sugar low, but about keeping your body strong and healthy. A small lesson: low blood sugar is not always good. Many seniors think that the lower their blood sugar is, the better, but in fact, that is only true if the body is not damaged in the process. What you need is a balance between medication, diet, exercise, and regular monitoring. And especially, don't be afraid to ask your doctor about long-term side effects. even if you have been on the medication for many years. A simple question like, do I need to check my vitamin B12, kidney function, or is there a milder medication, can completely change your health in the years to come. We all know that medication is an indispensable companion in maintaining health as we age. But when Helen, a 78-year-old single woman living in a quiet suburb, went in for a routine checkup, her doctor noticed something that worried him. Helen was taking 7 different medications every day: blood pressure medication, diabetes medication, arthritis medication, sleeping pills, and a few vitamin supplements. Looking at the long list, the doctor wondered, is this too much? Are they all working together, or are they secretly harming her? What is polypharmacy? Polypharmacy is a medical term for a person taking multiple medications at the same time, usually 5 or more. In older people, this is not uncommon. Many chronic conditions often coexist: diabetes, high blood pressure, arthritis, osteoporosis, etc. Each condition may require its own medication, but the truth is, the more medications you take, the greater your risk of interactions, side effects, and medication errors. For example, some medications can increase the effects of other medications, causing excessive hypotension or worsening kidney failure. Others interfere with the absorption of vitamins or important nutrients. Helen's story. Helen said that recently she often felt dizzy when standing up, lost her balance, and even fell a few times. After a minor accident, the doctor decided to review the entire list of medications. It turned out that the 2 medications she was taking for blood pressure and heart disease could cause rapid hypotension, combined with sleeping pills, making her lose consciousness and more likely to fall. The doctor coordinated with a pharmacist to adjust the dosage and replace some medications with non-drug methods such as physical therapy and nutrition. After 2 months, Helen felt better, no longer dizzy, and more confident when walking around the house. A short lesson. Less is sometimes more. It's not always true that taking more medications means better health. It's important to evaluate each medication carefully. Is it necessary? Can the dose be changed or reduced? It's perfectly okay to ask your doctor, I'm taking a lot of medications. Is there a way to reduce them? Do these medications interact with each other? How can I check for long-term side effects? Regular medication reviews with your healthcare team are key to avoiding the polypharmacy trap, helping you stay healthy for the long term without suffering unwanted side effects. Did you know that even the medications you can buy easily at the pharmacy, without a prescription, are not always completely safe? Imagine the story of Mr. Bob, a 65-year-old man who is very active and always takes care of his health. When he has a headache or a mild cold, he often buys over-the-counter pain relievers or cold medicines to help him get relief quickly. Explanation. Over-the-counter OTC means medicines that do not require a prescription and can be purchased at a drugstore or supermarket. But over-the-counter does not mean risk-free. Many OTC medicines, such as pain relievers containing acetaminophen or ibuprofen, can cause liver, kidney, or stomach damage if taken in excess or for a long time. In addition, when used with prescription drugs, they can interact and cause serious side effects. Real-life example. Bob did not know that the pain relievers he took every day could affect his blood pressure and kidneys, especially when he was also taking prescription blood pressure medication. After a while, he felt tired and his legs swelled, and when he went to the doctor, he discovered that his kidney function had begun to decline. The doctor explained that uncontrolled use of OTC drugs was the cause of his kidney damage. A small lesson. We often have the habit of taking non-prescription drugs lightly, but in fact, they can silently affect your health if not used properly. Small but valuable advice: always read the instructions on the package carefully. If you are taking prescription drugs, consult your doctor or pharmacist before taking any additional OTC drugs. Do not use OTC drugs for a long time without medical supervision. After exploring the potential risks of drug use in the elderly, you may be wondering, so what should I do next to best protect my health? Let me tell the story of Mary, 70 years old, a woman who is passionate about her family and community, but also faced uncontrolled drug use that affected her health. Explain. Mary used to take up to 8 different medications for her chronic illnesses. But when she started feeling dizzy and tired all the time, she decided to be more proactive in managing her medications. She started to carefully record each medication, dosage, and time of taking it, and made appointments with her doctor and pharmacist to review the entire list. Through that process, her doctor helped her reduce some unnecessary medications, adjusted her dosage accordingly, and instructed her on how to monitor side effects and drug interactions. Real-life example. Not only that, Mary also learned how to ask the right questions when she went to the doctor, such as, "Does this medication have any side effects that I should be aware of? Is there a treatment that requires less medication but is still effective? What can I do to support my body besides medication?" Thanks to that, her health improved significantly, and her spirit was also much more comfortable. A small lesson. Medication management is not just about taking it on time, but also a proactive journey, learning, asking questions, and working closely with your doctor. You can absolutely take control of your health, starting with small steps such as make a clear medication list and bring it to your doctor's appointments. Don't hesitate to ask your doctor about anything related to medication. Monitor your body's reactions and detect early signs of abnormalities.